Welcome to SROA Soundboard, a podcast for radiation oncology administrators. Here's your host, Tammy McCausland.
Hello and welcome. I'm joined today by Kevin Kindle, Jeremiah Reeves, and Nia Brown. Kevin is an assistant professor and program director of radiation therapy within the Department of Undergraduate Health Professions in the College of Allied Health Sciences at Augusta University. Jeremiah and Nia are two senior students. Thank you for joining me today.
Hi, thank you for having me.
Thank you.
So, in the current time, we're in a unique position in terms of radiation therapy because there's a shortage of people in the profession and entering the profession. So my first question is for Kevin. Could you talk a little bit about what it's like to be teaching and training radiation therapist students, I guess, or future radiation therapists at this time?
So actually not much is changing as far as like the education aspect goes. As far as the shortage of therapists goes, we're having more efforts on recruiting students now than we've had in previous years. So we have initiated some things where we go to high schools more often and speak to students that are interested in like STEM programs. And we're also now extending that to like middle school and elementary school students. So that has been like the biggest change as far as education is going so far.
So what kind of response are you getting since you're reaching like all the way down to elementary school? How is that maybe helping you to attract potential students down the road?
It's definitely bringing more awareness to what radiation therapy is because most people don't even know what the profession is. Like they hear radiation therapy and they immediately think of radiology and doing radiography and taking just x-rays or doing a CT scan or something like that. And they're not fully aware that radiation therapy is its own modality in treating cancer patients and the contact that we have with people and how we fit into the whole healthcare team. So I think it has been beneficial to reach those audiences early, so at least they are aware of it. Most people just think of, if they want to go into healthcare, they think of becoming a doctor or a nurse. And we are offering alternative pathways to careers in healthcare.
So about a decade ago or a little bit longer, there was the opposite scenario where there was a surplus of RTs. Have you seen since then a drop in enrollment, and do you have any idea why there might have been that drop in enrollment?
Yes, for sure. So a decade ago, we were having classes full of radiation therapy students. And probably around 2020, like the end of 2019, 2020, we noticed a decline in applications. And I think what has really exacerbated that has been the COVID pandemic and people just not continuing to go to school as much as they were prior to the pandemic happening, just across all the university, because I'm in meetings a lot with our administrators and the focus is on increasing enrollment, but it's really hit our imaging programs, harder, probably because there's a lack of awareness, like I was talking about before, but also people just not wanting to go through 2 years or 4 years of school when they can go find another alternative job where they might get paid, the same salary.
How do you sell the profession as being attractive, as a good option?
There are a couple of things. So the hours for radiation therapists are quite family friendly, I would say, or allow you to have a good work-life balance because we work typically, an 8-hour shift Monday through Friday. Mm-hmm. and there's no evenings or nights or third shift work. So we're able to go to work during the day and go and have our own family time or whatever time we need, personal time in the evenings and on the weekends. And we're still able to get that interaction and relationship with the patient. So a huge benefit of being with patients for an extended period of time is you get to build that rapport that you don't get with other modalities. So we see our patients for weeks at a time, and we become part of their family almost, where we become very ingrained in their healthcare journey and their treatment. So it's a great benefit, I guess, of being a radiation therapist as compared to some other professions.
Thank you. Those are great responses. I'm going to pivot to Jeremiah and Nia. What drew you to study to become a radiation therapist? And now that you're in your senior year, what is most exciting to you about actually leaving the education and going out to work?
So maybe 5 or 6 years ago, my mom was diagnosed with breast cancer. And throughout her journey, she would sort of keep me in the loop about what was happening because she knew I wanted to go into the medical field. So she had ended up talking about her radiation appointments, and I was like, what is that? It makes no sense to me. So I ended up doing some research on it and finding out what radiation oncology was, and the different people who come into play with treating cancers. And so I sort of stumbled upon radiation therapy like that, and that's really how I got into the program and got interested in what it was. And I think what am I looking forward to the most? Just really being out there, because we're in clinic 3 days a week now, and I think just going the 5 days and really being able to build that rapport with patients and seeing them every day helps you just remain closer to them, because over the summer, seeing them 4 times a week, they start to learn your name, they start to make jokes with you, they start to become more comfortable with you being in the room. So just being there consistently is what I'm looking more forward to.
Yeah, so for me, I'll say it started my senior year of high school when I was really trying to narrow down my college search and focus on, what did I want to major in college? What did I want to do career-wise? And I knew I wanted to do something in the medical field, so I just started doing research on that, but I didn't necessarily want to have to go through medical school per se to go to work in the field. So, of course you have nursing and, things along those lines, but I just wanted to see kind of what all was out there. So I came across radiation therapy. Like so many people, I didn't know what it was, so I did my research, learned a little bit more about it, and just really kind of became fascinated with the field ever since. And, I've had some family members, a grandfather, great uncles, and people who had cancer in my family, and I just kind of felt drawn toward it. I felt like it was part of my calling in life. And I guess what I'm most looking forward to about graduation is just really getting into the field, being able to work with the patient, see them on a daily basis, and also just the opportunity for career advancement, because that was another thing that I was really wanting to be mindful of. I didn't want it to just be a 4-year degree and that was kind of, the plateau. I was really happy that, we could go into medical dosimetry. You could possibly pursue a PhD in medical physics. I was glad to see that there are other opportunities and options to work in this field. So that's what I'm most excited about and kind of what drew me towards the field.
Those are great responses. Thank you. What is it like for you to be entering a job market where basically cancer centers are in desperate need of RTs?
It's great.
I'm excited. I feel like we're hitting it at the perfect time. So it's good to know that, it's not good to know that there's a need of us because, it would be great if they had enough, but it's good to know that we will be needed, and we will, be able to secure jobs after graduation, and to know that we're going to be a big help to, whatever facility or center that we decide to work at. So it's good to know that we're going to be needed.
Yeah.
And what are you looking for in terms of your first job in your career regarding things like work culture and maybe other things that are important to you?
Mainly the opportunity for growth. Like Jeremiah said, going into medical dosimetry, and I feel like at our first jobs, it's really gonna, I don't know how to put it, but put our feet to the pavement, like just really learning how to be a therapist. Because as much time as we spend in school, it's nothing like working that full-time job without having someone double checking your work. Like you're gonna have to be confident in yourself and your skills. So I think just sort of growing more comfortable with being a radiation therapist, and then also having ways that I could pivot into bigger opportunities.
For work environment, I would say just a positive work environment. We've been to several different clinical sites and they all have different environments. They all interact with each other differently. But, from that, we're able to see kind of the things that we like and the things that we don't like. So just a really positive work environment where the therapists all get along. The physicists, the dosimetrists, the doctors, they're all working together collaboratively for the better of the patient because, we're all there for the patient. So just any type of environment where we can work together for the good of the patient is what I'm looking for that, first job.
If you don't mind me asking, have you been approached by prospective employers already, even though you have another, year of school to go?
They always say that clinicals are like job interviews. So in a way, yes, like if you do really well with the clinic and your personality matches that clinic personality, I have had a few instances where they say, if you're looking for a job after school, don't be afraid to come here. We will definitely work with you and try to get you on our payroll.
Yeah, just like what Nia was saying, instances of that where they're just like, if you're ever looking for a job or, just don't be afraid to reach out. I'll write a letter of recommendation for you, things along those lines.
Kevin, have you found that prospective employers are reaching out to the school, looking to recruit people before they're even done?
Yes. So, especially over the past 2 years. So I've had clinical managers ask about creating radiation therapist assistant jobs for students so that they can ultimately kind of just train them before they graduate with hopes of retaining them after they graduate and hiring them as a full-time radiation therapist. I've gotten emails from previous students who are now working out in the field, and their managers are asking them to reach out to their program directors and tell them about job openings. So just yesterday, I got an email from the Mayo Clinic in Florida. Previous student works there. Their manager is looking to hire graduates. So yes, I'm getting tons of job offers. And then that's not to mention just like the headhunters and recruiters from staffing agencies that send out emails about openings. So yes.
What advice would you have for radiation oncology administrators and hiring managers who are looking to recruit new RTs?
My biggest piece of advice for administrators is to be an open and friendly clinical site for training students. That is probably the best way to recruit and retain employees, because all radiation therapists have to go through clinical training. And what better way than to kind of groom someone while they're being educated to be a future employee in your site. So my biggest advice for administrators would be to promote a positive work culture in their clinic and always be active participants with education programs. So even if they're not in the immediate area, there's always possibilities of collaborating with an education program to help get new employees or students in their facilities.
And Nia and Jeremiah, do you have any advice for hiring managers?
I think Mr. Kindle said it
Yeah.
best. I mean, from a student's perspective, we definitely want a clinic site that is open to training students, who is providing a good and positive work environment, climate, and culture. So those are just all the important things when it comes to just, like Mr. Kindle said, just grooming us up to be radiation therapists, just providing a good environment overall for the student. And I think that'll help, when it comes time for students to look for jobs. Then if they had a really good experience, they felt like they were, learning, the people that were open to the students, then I think that would be more appealing, to want to potentially work there in the future.
Yeah.
Do any of you have any final thoughts?
No.
I don't know, I'm just excited.
Yeah.
Honestly, I mean, graduation's coming up. Just looking forward to, what the future has to offer, and just kind of see where it takes me, because I know this field is always changing, so just trying to be open to that.
Yeah.
Just
Always
excited.
changing, always growing.
Yeah.
Great. Well, thank you for your time today. I really appreciate it.
Thank you.
Thank you.
Thank you.
Thanks for listening to today's podcast. To learn more about SROA, visit www.sroa.org.